Hey, what's up everyone? This is Julie here and welcome to my CNA YouTube channel. Don't forget to hit that subscribe button, kick that like button on this video and all of my other videos. And don't forget to ring that notification bell so you will be notified whenever I upload new content. In this video, I'm going to be demonstrating how to perform the CNA testable skill, feeds client who cannot feed self. This skill is performed on a live person, but for training purposes, I'm going to be performing this skill on a mannequin, okay? But just remember, it is performed on a live person. So what supplies you're going to have to gather will be a spoon. I always tell my students to get 2 spoons because sometimes it's a little hard to scoop that fruit up onto the spoon, so that second spoon you can actually use to help scoop up the food. And you'll need to collect hand towels or wet wipes or even a damp washcloth, okay? The cloth that you use to clean the person's hands before they eat and to clean their hands and mouth after they eat has to be moist. If it's not moist, if you use a dry cloth, you are not going to receive credit for those steps, okay? So just make sure the cloth you use is moist. Again, you can use wet wipes, you can use hand wipes, or you can use a damp washcloth or towel, okay? And then you will need to gather a cup and put some water in it, all right? So let's go ahead and get started. Okay, so when you come to gather your supplies, the NAE or nurse aid examiner or evaluator will already have the meal tray set up with the fruit cocktail, okay? As you can see here, she's going to have, or he is going to have 4 or 5 pieces of fruit on the tray. There is also going to be a name card on the tray. If the name card is not on the tray, just look somewhere on the supply table, okay, so you can get the name card. So what I'm going to do right now is I'm going to get a cup, see my cup, and I am going to fill it with water. There we go. And I'm going to put it on my tray. Right there. Gather 2 spoons, okay, 2 spoons. And as you can see, in my classroom, I also put forks on the supply table because I need to know that my students have a good understanding that the resident has to be fed with a spoon, okay? So the NAE, some NAEs will put forks on the supply tables, others will not, okay? But just so you know, you have to use a spoon to feed the client. So I'm going to go ahead and put these on the tray as well. I'm going to get 1 or 2 hand wipes. Okay, my hand wipes right here. I'm going to put them on the tray. And close this back up. And now I have everything that I need. You do not need gloves for this skill, okay? And I'm going to go ahead and set my tray down on the overbed table. Good morning, Mrs. Jones. My name is Julie. I'm your CNA, and today I'm going to be helping feed you, okay? But first, I'm going to do a brief safety check. I just want to make sure your bed is in a low, safe position. Your bed wheels are locked. I'm going to give you your call light in your hand, okay? And I'm going to provide you with privacy. And since I'm feeding you, I'm going to raise your head of bed to a high Fowler's position. So you want to go ahead and do everything in your opening procedures. Again, you're only required to perform your opening procedures, which is addressing the resident and introducing yourself once during testing, and that's usually before the first bedside skill. But I always have my students to perform the opening procedures before they begin their first skill, which is hand hygiene. And I always tell them, just go ahead and do it before every skill, because there are some steps that require the bed to be locked, the bed to be in a low position. So just in case you forget, you've already done it in your opening procedures. So once I get her to a high Fowler's position, and remember, in your book it says 75 to 90 degrees, but what's 75 degrees to you may not be 75 degrees to the NAE. So I would just go ahead, I'm just going to straighten the mannequin up, she looks uncomfortable. I would just go ahead and raise the bed to 90 degree, okay? So there won't be any room for questioning. Okay, so the next thing I'm going to do is grab my tray, okay, the overbed table. I'm going to pick up the name card, okay? You do not want to leave the name card lying down in the tray, because that NAE is not going to know or be able to tell if you're looking at the name card or just something on the tray, right? So you should pick it up. And once you pick it up, you need to look at it, and then you ask the live candidate, because remember, this is performed on a live candidate. I'm only performing it on the mannequin for training purposes. You will ask the person to state their name. Can you tell me your name? Okay? And that's all you have to say. Can you tell me your name, or will you state your name for me, please? Once the person states their name, that's when you can go ahead and place the name card down on the tray. I'm going to go ahead and position the tray in front of the person. I'm going to ask them, are you able to see your meal? Okay? Again, you don't want to leave any room for that NAE to question whether or not that person can see their meal. Now, when it comes to the chair, it specifically states that the candidate needs to be seated in front of the person, facing the person. If you place your chair here and sit like this, you're not facing the resident, okay? The only time you're going to be facing the resident is when you go to feed them. So you need to make sure that you position your chair exactly as the step requests you to do, right? And that's in front of the person, all right? So I have my chair, I'm seated in front of the person, and the first thing that I'm going to do is wipe the candidate's hands. Ms. Jones, I'm just going to clean your hands. And I'm going to take this call light, I'm going to leave it right here so it's still within your reach. Okay, and I'm just going to place this here. And the next thing, after you clean the person's hands, you need to tell them what is on the meal tray and what beverage they have. Okay, don't forget the beverage. Mrs. Jones, today you have peaches, cherries, pineapples, and pears, and you have water to drink. Now that I've told her what was on her meal tray and what beverage she has, I'm now going to ask her what she would like to eat first. Mrs. Jones, what would you like to eat first? Again, you have peaches, pears, cherries, and pineapple. She's going to tell me what she wants to eat. And see, this is why I tell my students to get 2 spoons, because you can scoop up the fruit with that second spoon. Easy peasy, right? Okay, Mrs. Jones, here you are. You're going to feed the resident. Okay, she really can't eat because she's a mannequin. All right? So give them time to chew their food and swallow it. And then I tell my students, once during the meal, you have to offer the person something to drink. I instruct my students and train them to do this after the first bite. Okay, so you won't forget. Mrs. Jones, would you like something to drink? Now, the live person, they can actually hold their own cup in their hand. Okay, so you can just hand it to them in their hand. But since she's a mannequin, I'm not going to do that. So she's going to take a drink. There you go. All right. Would you like something else to eat? Okay. I tell my students, if they're acting as the acting candidate, say no. Okay. And the reason being is because this way you can actually help your partner with time. Okay. So just take the one bite, let the candidate offer the drink. And then when they ask you if you're ready for your next bite or if you would like something else to eat, just say no, okay, to help that person out with their time. So if the acting candidate asks or requests something to drink before the testing candidate has time to ask, you will still get credit for that step, okay? But I'll always tell my students to ask the person if they would like something to drink after the first bite. So she doesn't want anything else to eat or drink. So now what I'm going to do is I'm going to take a paper towel. Mrs. Jones, I'm just going to wipe your mouth, okay? And I'm going to clean your hands, all right? So you go ahead. Remember, before eating, you need to clean the person's hands. After eating, you clean their mouth and their hands. All right, Mrs. Jones, we're all done here. I'm just going to move this tray out your way. I'm going to go ahead and give you your call light. Just want to do a quick safety check. Your bed is still in a low safe position. Bed wheels are locked. You have your call light here within reach. Privacy is maintained. And I'm going to leave your head of bed in a high Fowler's position, okay? Do not lower the head of bed, okay? Do not lower the head of bed. So what I've done is I've actually already done my closing procedure. So whatever skill I have next, once I close out the skill, I can go ahead and collect my supplies for my next skill, okay? All right, Mrs. Jones, I'm just going to remove your meal tray from the bedside, and I'll be right back, okay? Now, the NAE will tell you once you remove the tray, he or she will tell you where to place the meal tray. It's usually going to be at the sink or around the sink area or the designated dirty area. If the NAE does not tell you where to place the meal tray, just place it in the designated dirty area, okay? Now I'm going to take everything, and you see I didn't throw anything individually away. I'm just going to place the entire tray in the designated dirty area, okay, designated dirty supply area. I've placed my tray. Now I will verbalize washing my hands. Skill complete.